Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the fact that most presentations of peripheral neuropathy, most of the time when you get peripheral neuropathy, it is a combination of multiple different causes. It's not usually just one cause. Now, as I've said for many years, there's 125 different causes of peripheral neuropathy, and you can have any one of those or multiple of those. But what I want to tell you today, what I kind of want to give you an example for today, is the fact that in most cases, there are multiple causes, multiple different problems that are occurring. Now, I'm going to take the most common cause of peripheral neuropathy, diabetic peripheral neuropathy, and I'm going to show you that even in the case of diabetic peripheral neuropathy, that is not the only cause of the symptoms and the problems that come with diabetes. So, what's the problem? What's the problem with diabetes? It's a blood sugar problem, right? You have an increased blood sugar, you have a hyperglycemia in the body, and the interesting thing is the Schwann cells and the neurons, the nerve cells, are less able to reduce the problems that come from this high blood glucose, the hyperglycemia. In fact, Michael Brownlee in 2005 has a study that shows that those two types of cells, the Schwann cells, which create the myelin sheath, and the neurons, the nerve cells, are unable to control the increase, the hyperglycemia or the growth of hyperglycemia in the cells, causing cell damage. So you're basically glycosylating the cells, you're glycosylating the endoplasmic reticulum, the Golgi apparatus, the mitochondria, and you're causing the damage that can occur to the point that that nerve cell or the Schwann cells, myelin sheath, are getting damaged because of the hyperglycemia, which they are unable to control like other cells do. This is this landmark study in 2005. It is actually proved, and so that's one of the mechanisms of diabetic peripheral neuropathy. Mechanism number two, there are studies showing that in diabetics, you will actually get a calcification of the lining of the blood vessels. And so you'll start to interfere with the blood flow, and so you can get a vascular cause of your peripheral neuropathy because the blood flow to the nerves are interrupted or interfered with, and the expansion and contraction that usually should happen in the blood vessels are not happening. So because of that, so you've got the hyperglycemia cause, which causes cell damage. You've got the blood vessel cause, which is caused by diabetes as well, but it's a vascular problem. And if you treat the vascular problem, even if you're not treating the blood sugar as well, you will get improvement of your peripheral neuropathy. But let me go a step further. In individuals with diabetes, you also have kidney issues. You have kidney problems a lot of times, and you're going to have a decrease by up to 75% of thiamine levels. You'll have a 75% lower thiamine level in a diabetic compared to a non-diabetic. So what we're talking about now is thiamine is vitamin B1, and we're creating a level that interferes with the functioning of the nerves. So you have a thiamine deficiency, which is also part of your diabetic peripheral neuropathy, that is causing the peripheral neuropathy. So you have to treat the blood sugar, you have to treat the thiamine, you have to treat the circulation to improve diabetic peripheral neuropathy. Now, let's take this a step further. Some of the treatments, actually, before we go there, let's look at why is there a lower level of thiamine? Well, the truth is the THTR2 transport that gets thiamine into the cells or into the body malfunctions. It starts to fail in diabetic peripheral neuropathy. So you get a lower levels of thiamine. So that is the reason that you have a thiamine deficiency. It is treated with benfotiamine because benfotiamine has an independent mechanism. It doesn't use THTR2 to get into the body or to get into the cells. It uses a independent flow, which actually allows it to get in just by the normal mechanism of absorption. So because of that, Benfotiamine, it is a good form that can be modified to become thiamine and actually improve the thiamine levels. So you're basically saying, okay, we're treating the vascular problem. We're trying to keep the blood sugar under control. We're also doing thiamine, benfotiamine, to improve the thiamine levels. But what about if you're taking certain types of medications? Did you know that the most common medication used for diabetes is metformin? And metformin is proven in multiple studies to interfere with thiamine levels in the body. In fact, it causes a decrease or a lowering of the thiamine levels, causing peripheral neuropathy. So you may be treating the diabetes to keep your blood sugars under control, but at the same time, you're creating a thiamine deficiency or a deficiency peripheral neuropathy. So when you're looking at your peripheral neuropathy, when you're looking at your problem, you need to say, okay, I need to look at the full picture and not just say, okay, if I control my blood sugar, it's going to fix everything. Not necessarily. You need to look at what are the other causes of your peripheral neuropathy that can be treated as well. So in the process of trying to manage the symptoms of peripheral neuropathy, or in the process of trying to control the nerve damage, you need to treat all the pieces. And so you need to understand your peripheral neuropathy. So when you go to your doctor to get evaluated for and treated for peripheral neuropathy, you need to say, okay, I need to know all the possible causes so I can treat all the possible causes so that we can say, yes, I need vitamin B1, benfotiamine. Yes, I need to change my medication because it may be causing my peripheral neuropathy. Yes, I need to work on my circulation. Yes, I need to actively be working on exercise to improve blood flow and so forth, but also to decrease my blood sugars by exercise and some of those kind of things. So basically, you're hitting it from a whole bunch of different ways that are focused on the individual causes. So commonly when I'm talking with patients, I'm saying, okay, there are a couple different ways that you can treat peripheral neuropathy. Some individuals will find one thing that works. They find one piece of the puzzle that works. They're going, okay, all my peripheral neuropathy patients are going to be put on benfotiamine. Some of them will improve. The problem with that is you're treating one problem, one cause of the peripheral neuropathy. You're not treating all of them. So you're missing pieces. So you're going to say, I'm going to only get a slight improvement, or I'm only going to get a partially improvement because I'm not looking at all the things. I like to use the shotgun approach, but I like to have it be a focused shotgun approach. I'm just not going to throw everything at this. I'm going to say, I'm going to do a focused shotgun approach where I'm saying, as I'm shooting the shotgun, I'm hitting this piece with this, and I'm hitting this piece with this, and this piece with this, and this piece with this, so you can get the whole picture and actually really say, I've got complete control of my peripheral neuropathy because I'm doing a combo treatment that hits all the causes of my peripheral neuropathy so that it can improve. So as you're looking at your peripheral neuropathy, find out what the causes of your peripheral neuropathy are and treat each individual cause in a combination therapy, and you will be amazed at how much better and how much quicker your peripheral neuropathy can improve. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, Day 80. Think about combo treatments. Because if all you're doing is treating one thing, you're not treating your peripheral neuropathy. You're only treating one little tiny part of your peripheral neuropathy.